Good afternoon and welcome to the first meeting of the new calendar year of the Board of Early Education Care here in Massachusetts. Nice to see fellow board members and welcome to everybody who is joining us. Not surprisingly, our agenda is largely reflective of both the ongoing public health landscape and its impact on the workforce and the early education and care system overall. And with an emphasis, as we've seen in recent weeks, that the landscape can also change very rapidly, which requires agility and flexibility from programs from the system that supports them and is challenging for everybody involved. And certainly want to acknowledge as a board that we've received a lot of public comment in advance of today's meeting, and hope that the agenda itself is both enlightening for us and for the field as to where we stand and what makes sense going forward, and look forward to continued dialogue in that regard. So our first item reflects a deeper dive on the agency's plan to manage through this next phase of the pandemic as safely as possible and with deep commitment to educators as they continue to do their very instrumental work under such challenging circumstances. So specifically, we'll spend the first part of our meeting looking at COVID metrics and policies given the state of the pandemic today, and we'll enhance our own understanding of the department's expanded efforts to support programs in their COVID mitigation efforts. Then we'll also shift gears and hear from the commissioner on the operational grants related, of course, in more detail as a follow-on to the December meeting, and with a focus on the metrics and the flexibility and local solutions as a design principle there. Finally, we'll get some updates on educator recruitment, retention, and support strategies that we've discussed over the last several months, and want to follow up with some potential concept that we're sort of floating by you today, and talk more individually offline after today's meeting about some priority board work over the next several months in the domain of workforce innovation, kind of harkening back to the retreat and tying through to November and to today. And I think it's the right item to end on, just as a quick discussion, and then we will talk more in the weeks to come. So with that, I'm going to turn it over to the secretary.
Thank you, Madam Chair. I appreciate it. I think what I'd really like to focus on are some of the announcements that were made today by the governor. As many of you may already know, he announced that the administration has placed an order with iHealth for 26 million rapid antigen tests to be delivered over the next 3 months. And the tests are being prioritized to support both K-12 and early education and childcare. So that doesn't mean all the 26 million are dedicated for that purpose, but clearly that's the priority in terms of how to have the biggest impact as soon as we possibly can. The shipments will be coming in on a rolling basis over the next 3 months. And as you know, there remains some uncertainty regarding the timing and amount of individual shipments due to the continuing global supply chain issues, a term that I think we've all become familiar with over the last few weeks. So it will take a little time to build up sufficient stocks to make specific commitments regarding distributions to the field. But the commissioner is working closely with the administration to develop plans regarding use cases and logistics. And we'll be hearing more about that in the context of today's meeting, to ensure that we can help our providers address their most pressing COVID challenges as soon as possible with a sufficient supply of rapid tests. The bottom line is this is very important and positive development, but not everything is under our control, and there is still more work to do. The administration has also released updated public health guidance advising all residents to seek COVID-19 tests, either if they have symptoms or 5 days after a known close contact with someone who's been diagnosed with COVID. This complements guidance that was issued on December 29th, advising that individuals who are isolating with COVID do not require a negative test to exit isolation if their symptoms are resolving and if they wear a mask for an additional 5 days. There are obviously more details on these protocols, especially regarding quarantine procedures. So people should go to the mass.gov website for more information. They should, of course, also consult the EEC and DESE websites for more specific guidance related to childcare and K-12 and their distinctive populations. So there are some subtle but important differences in each of those. And so depending on the program, depending on the child, you ought to consult those sites as well. And on the subject of K-12, you may also have probably heard that Commissioner Riley has extended the indoor mask mandate from January 15th to February 28th, following the February vacation. And other than that, other than the date change, nothing has really changed. So it doesn't affect existing EEC policy mandating masks for adults and children 5 years and older in childcare facilities. So with that, Madam Chair, let me pause. I was going to say and ask for questions people may have, but honestly, I don't think I'm necessarily in a position to answer all those questions. And I think that's part of the conversation we'll be getting into through the rest of the agenda today. So with that, let me turn it back over to you.
Great. Thank you. I'll turn it over to Commissioner, likely for some brief comments before we dive into the meeting.
Excellent. Thank you so much, Madam Chair and Secretary, for laying the context for where we are, and Happy New Year to everyone and to the board. As you know, this new year has brought sort of reminiscent of the last couple of years of understanding how and where the needs of childcare are unique, and being able to continuously be reminded of how crucial our childcare infrastructure is to remain operational as we navigate the recovery period. Of course, this is, I think, as Chair Lasso pointed out, the linkage to the workforce is critical, because while we can very intentionally be thoughtful about the childcare infrastructure, the quality of the early care and education delivered within that infrastructure is about the workforce and the humans that are in caring for those children and educating them every day. And so really what we're looking at today is to talk about our strategies to help make sure that the childcare infrastructure can remain in place, can remain operational, can continue to care for children and be available for children, and also the intentional strategies to be able to support that critical workforce in being able to deliver high quality care and education within the infrastructure we're maintaining. So I wanted to be explicit about the balance that we are having as we look to not only learn from the last couple of years of the pandemic, but also look ahead to the next couple of years as we navigate recovery, to making sure that we're not only maintaining the infrastructure, but also building the foundation and things like the workforce pipeline we'll talk about today, which is intentionally thinking about the services delivered within that infrastructure. Just to quickly highlight a couple of things that we will deal with a little bit in more detail today, and one that we won't. Certainly, I want to highlight the fact that, as the Secretary said, when the CDC updated the guidance over the holidays, EEC did put out updated guidance for our providers, but reminding us that unlike a school district type infrastructure, our childcare providers are independent operators, and so do have the discretion to be able to make the decisions for their own children, their own families, and their own communities safely allows you to
got some 21st century Wi-Fi problem here. Just hang on one second. See if Sam comes back.
Oh, are you able to still hear me now?
Yeah, so I think you just want to back up to the independent operators who can make those decisions for their own children.
Thank you so much. Thank you. So reminding people that our childcare providers are independent operators, can make decisions for the children and communities, and how they apply our guidance to keep their operations healthy and safe, and making sure that it is meeting the needs of their families and their workforce and staff, and the confidence to keep operating. So just to be able to make sure that we continue to reiterate the emergency regulations that you all pass for us at the end of the year do allow us to apply specific requirements around PPE, but have not allowed us to go above and beyond our regulations in terms of mandating closures for childcare in any way. And we expect our programs to be able to put that in their illness policies, which is a current regulation for all transmittable transmittable diseases, and to be able to make sure that their businesses, their nonprofits, or their operations team understands very clearly what their own policies are, and that those are communicated to parents. So we'll talk a little bit more today in more depth around the strategies we are employing to support programs in implementing their policies. But I also wanted to touch on one quick component that we won't talk more about today that you'll find in the appendix of the board materials that are online and available to you all. And that is just looking at our continued enrollment numbers of our subsidy system. I highlight this not because there is any big story to tell, but because I think what you see in the fluctuation of enrollment over the last few months is indicative of what is happening in the field, which is a lot of change for parents that is impacting their decisions around childcare. So you'll see from our enrollment fluctuations and our waitlist numbers that we still do see that parents are opting into choices that we don't always have a clear path to understand. And so we're closely watching these numbers and understanding and working with our subsidized providers specifically to understand our childcare resource and referral agencies, our family childcare systems, those providers that are engaging with families around our subsidy system, to understand why parents are making specific choices and why we are seeing these fluctuations in enrollment on a monthly basis. It's not something that EEC has a very clear lens into, since we ourselves don't talk to parents, and these are clearly choices parents themselves are making based on the pressures they are feeling. And we have very little lens into the non-subsidized enrollment at all. But I wanted to highlight the data and to highlight to the board that while we won't discuss the enrollment patterns in depth today, it is something we're watching and inquiring about and working with our stakeholders on, because we know ultimately the system that we are sustaining, the early education and care that we are delivering, is only as impactful as the families are enrolling in it. And so I wanted to highlight that those numbers do seem to be telling an inconsistent story, and we're trying to understand better about what that looks like on the ground. And with that, I will hand it back over to you, Madam Chair, and if you can continue with the meeting.
Great. So we have 3 sets of minutes, 2 meetings in November and 1 in December. So I'm just going to move through that review and vote for each of those, and then we'll launch into our 2 items. So I'd first like to, anybody have any edits or amendments to any of the minutes before we get started?
Madam Chair, I have one. On the December minutes, in my comments, the last sentence says, talks about how I noted the governor is allocating approximately $1 million to address critical workforce shortages in private special education schools, and that should read 79 million, which is more than 1, which is good news. 1 probably wouldn't have really cut it. But yeah, so that, if that were 79 million, that would be.
All right. So we're voting on that. We'll assume that gets fixed, and we'll vote on that as corrected. Thank you, Secretary. So let's start with the minutes. I want to make the motion that we approve the minutes from the EEC board meeting Tuesday, November 9th, 2021. Can I have a second, please?
Second.
Thank you, Paul. I'm going to move around my screen and I'm not going to call on Joni or Allison because they were absent from that meeting. Carolyn Kane.
Yes.
Secretary Pizer.
Yes.
Maura Siegel.
Yes.
David Cruz.
Yes.
Jamila Lee.
Yes.
Paul Belcedo.
Yes.
Thank you. Approved. I next make the motion that we approve the minutes from the Monday, November 29th, 2021 meeting of the Board of Early Education and Care. And I will not call on Allison in this case. Joni Block.
Yes.
Carolyn Kane.
Yes.
Secretary Pizer.
Yes.
Maura Siegel.
Yes.
David Cruz.
Yes.
Jamila Lee.
Yes.
Paul Belcedo.
Yes.
Thank you. Approved. And finally, we have, with one amendment, I would like to make the motion that we approve the minutes for the meeting of December 14th, 2021 of the Board of Early Education and Care. Could I have a second, please?
Second.
Thank you. Joni Block.
Yes.
Carolyn Kane.
Yes.
Secretary Pizer.
Yes.
Maura Siegel.
Yes.
David Cruz,
Yes.
Allison Schoenwald,
Yes.
Jamila Lee,
Yes.
Paul Belcedo.
Yes.
Thank you. So moved. All right. So with that routine business, we will turn now to our first item for discussion, which is the COVID response, as it were. Thank you.
Thank you so much. I wanted to start as we are talking today with understanding that we are both in the middle of a surge, but also in the middle of a recovery from a pandemic. And so the balance of what we've learned over the last 2 years and how that informs not only the systems that we're setting to deal with the immediate surge, but also the way we're learning about setting up systems that can sustain us as we see the cycle of the pandemic recovery occur for the next years. As I think we are all beginning to understand in real-time ways, is that this is something we are going to learn to live with in different ways over the next couple of years, and understanding what kind of systems our childcare needs to be able to do that safely, continue to operate, protect the workforce, ensure children and families have confidence in the ability to attend childcare, and make sure that we are building the ability for them to be responsive to the real-time situations you see in the middle of the recovery situation. So I wanted to start today. I know that you all have, or many of you have been with us through the last couple of years thinking through our response and what we've been learning. But I took an opportunity as we've looked at some of the systems we're trying to set up to be able to capture not only to capture what we have done over the last couple of years through the periods, but I'd also like to take a moment to step back and reflect on the ways that taught us to both listen to the field and respond as timely as possible, not only with urgent things for in this case that we've just come through the holidays, but being able to distribute an initial batch of tests, but also then really thinking through what kind of systems do we need to set up that are sustainable, that we have actually had some success and track record in the last couple years. So I'm just going to take us through a quick journey of what we've learned, and I won't read the slides, but it is indicated in the first section of the slides that are for the board meeting today. So I will just quickly call us all back to March of 2020, when we were sitting in a board meeting discussing the strategic plan, and I was asked a few times, what are we going to do if this pandemic thing happens? I don't think we were calling it a pandemic at that point. We were still saying if COVID impacts childcare, and we were getting dramatic emails about the need for us to close, or a dramatic amount of emails about the need for us to have a statewide closure of childcare. As we went through that, the decision to close childcare really was coupled with the fact that in order to keep our critical infrastructure running, in order to have hospitals running, in order to have grocery stores running, in order to have delivery services running, that we would need to have some childcare available, and it would need to be accessible in a really urgent way. So coupled with the idea that we were going to be able to close childcare to protect the massive amounts of our workforce that needed to be able to step out of a group care setting to keep themselves and their families safe, allow us to have programs opt in to being able to provide this really critical service and have funding available. I have to say that that was the first time for me personally that I ever saw the EEC team move as fast, and I've seen it many times since, but move as fast as we needed to be able to not only design an application for emergency childcare program, collect those applications, verify that people were in good standing, advertise who was going to be available, and allow it to be available for parents, getting weekly payments out, because we didn't know whether we'd be in this emergency childcare for 2 weeks or 2 months. Or what ended up being multiple months. And so I just want to harken back to that being the first opportunity for us to not only think differently in EEC about how we pivot really quickly, set up interim systems that needed to sustain long enough to be able to get through the crisis and learn from it. I will tell you and our licensors will remind us, I think sometimes those who participate in emergency childcare may or may not want to remember this, that those first couple of weeks, we had no system set up for that. We were literally calling programs every day to find out how many children they had, whether it was being utilized, whether we still needed this program, until we were able over the first couple of weeks to build a system that allowed us to input that information and start to be able to track on a daily basis whether we were seeing utilization. We became a model for the country to be able to respond in this way with this emergency free childcare for essential workers. And it was really a amazing point, learning at an initial point for me, 5.5 months into quite a large position and large job you were all charging me with, to really understand what the next 2 years would hold. Evaluating quickly the need, making very quick decisions that would allow us to start a system that would grow over time as we learned about the needs of the community. That is something I just wanted to highlight, that because that, as I reflected on the last couple of years, recognize that every action we've taken since then has followed a similar pattern. Understanding the immediate need, the immediate research that was available to us, setting something up, and then growing and learning and being very iterative along the way to understand whether this was something that was working, whether it was something that would need to be in place for a day, a week, a month, or a year, and then allowing us to stabilize it over time and grow it to respond. I think as we head into this period of the pandemic, that this continues to be something that is a theme that we have continued to embody. The second thing I wanted to focus on as we've looked at this is, in that first urgent needs, are the two other themes. One, focusing on what families and children need. We have tried to provide as much flexibility. We knew, for example, in those first couple of weeks, as we were hearing from families that were at home with their children for the first time, that they needed things to do with their children. They weren't used to being with their children all day long, and programs didn't yet have remote learning opportunities up, if you remember, in those first months. They didn't yet have the systems that support. We were all building them together. And so quickly we were able to develop take-home things for parents to be able to use with their children, and to support that connection with those experts, those childcare educators, the early education professionals who were able to really use these as opportunities to talk to parents about what they can do to help engage their children in the meantime. We worked, with our CFCE providers. We work with our CCRNRs. We work with all of those who had different kinds of relationship with parents to provide resources to parents that could help them serve in this very new kind of role they were having to play in very quickly. We also, the third theme I wanted to point out in this is the responsiveness to stability in programs. When you are asked as a state government, just to put this out very quickly, to change program, to change the landscape and how we're supporting programs, that's not typically the way that bureaucratic systems get built on a dime. And so really being able to think about when we've looked at things like enrollment-based subsidized payments, being able to take our current systems, make minor modifications that focus on stability for programs, and then build on those with additional type strategies like the operational grants that came later. So I wanted to just highlight that from the urgent first few weeks and months of the pandemic. But then, of course, we all learned that we would be reopening and understanding exactly what would happen to open and function under a state of the emergency. So I wanted to highlight that as we did that, one of the things we, again, as the secretary had pointed out early on in his comments earlier on, is that we started to see issues with supply chain, of understanding how we didn't necessarily dub it that way at the time, but that getting PPE, making sure our programs who are largely smaller entities who didn't have the buying power of, you know, a school district or a larger type entity, how could we as a system start to support that? I think what this taught us in this time is not only where we could start to think about our role of aggregating our programs into a larger constituency that would have more buying power for PPE, for example, leverage state contracts that they may not be able to do individually, but we would be able to do as a department, and really thinking about how that has some implications for the way we talk about things in early education and care, like shared services. Like when we try to think about those areas that can be most impactfully aggregated and support a program in taking some of the administrative burden off of the day-to-day and allow them to focus on those services to children and families. As those of you who remember, our first attempt at this did not necessarily fully achieve the goal. We started by getting PPE, but had no way to distribute it. So we put it at our regional offices, which in full disclosure, as much as everyone was as game to help as possible, it was hard. It was hard for our providers to leave their place during the day to pick it up. It was hard for our licensors to figure out how they helped a provider get PPE in the middle of having to disinfect and keep their gloves on and not have, at the time, we weren't really even sure about full transmission of this virus. And so we were leaving things out on the doorstep and having people come and pick them up. And that was really hard. And over time, as we realized that we had the buying power, but didn't have the system in place to make sure it was really impacting what we wanted to, we were able to build a distribution channel, a web portal where people could go on, order their PPE. Not only did that make it much easier for our providers, not only did that make it much easier for our licensors and our regional office staff who were no longer having to coordinate leaving things outside, but it also was much more efficient for the state because now we were able to let providers order what they actually needed instead of bundling things and hoping we had enough and oftentimes giving too much. And so we were able to really start to build a system that allowed for efficiencies and also that support. But it took time. It was not overnight, and we took incremental steps towards improving, which is a theme I think we'll continue to talk about as we look at the next, the phase we're in now and ahead as well. And then I also wanted to highlight in this, as we've looked from that reopening stage and what we learned in moving forward, is around the operational costs. We had, prior to COVID in our strategic planning, started to look at the operational costs of providing high quality early education and care in Massachusetts, and recognized very quickly that when you, much like a supply chain, when you stop a system and restart it, those operational costs compound very quickly. And so in those first months, we were able to address some of this in small ways through the CARES Act funding that the federal government provided us, that allowed us to really focus on those costs of reopening. But as providers started to then operate in this new environment through the summer of 2020 and the 2020-21 school year, we also recognized that there were increased operational costs to just be able to operate every day, not just the startup costs. So as we move from that reopening phase into that responsive phase through the school year, we had to make a lot of pivots. We executed multiple executive orders with our the governor's office to be able to do things like unlock the school day. Traditionally, if school is provided in person, our childcare providers don't operate during that time. So to be able to partner differently and think differently was real quick action to be able to move from, okay, it's going to cost you more to operate during this time, and now we need to ask you to operate completely differently as well. We did things like be able to provide additional guidance in coordination with DESE. We did things by like being able to provide remote learning grants to communities that were able to support those resources that cost more when you're operating in a pandemic, and even more when you're operating in a whole new type of service to programs, to children and families. and really think about all of those resources they need. We distributed computers, we tried to provide updated guidance, and really trying to learn throughout that year and develop things on the fly that would invest in those new needs we didn't know we had. So for example, with the family childcare providers, we hadn't really thought about the need of computers just to be able to care. But now you had providers who had children in multiple classrooms, who may have had multiple assignments from multiple teachers, needing to negotiate in a single provider, who now all of a sudden maybe didn't have an up-to-date computer to be able to engage with the different portals. So we were able to deploy over 1,000 computers to our providers to try to help with things like that. I say that because the theme continues. We are learning as quickly as possible with the real theme of how do we set something up that will start, understand what needs to stabilize and grow and be sustained, and understand what is an emergency response like PPE that needs to morph into something very different in order to really be supportive. The entire time focusing really on how do we help everyone maintain the focus on children and families and what they need to be able to navigate this really tumultuous time in their own communities, and stabilizing providers so that we could maintain the system we have and really think about building back in a way that would allow us to really honor the dedication of the field throughout this year. So here we are, as we've looked at the last couple years, and I wanted to just be able, before we hit on the infrastructure, just also to talk a little bit specifically about the subsidy. Before I do that, Joni, did you want to add in something?
Thank you. Thanks. I think it is amazing about all the work and the supports that everybody at EEC has done for the field. You had mentioned the idea of what do families and children need in addition to access to the child care programs. And I just want to shout out to some of the other partnerships and initiatives that EEC has been involved with. There was some wonderful work from GBH, certainly, that was provided to families who typically aren't in any formal early childhood program. And that was, those were resources to provide activities, information, materials to families. The access to community resources that so many of our CFCE and R&R partners were able to provide, just the basic needs, food, shelter, that this really came alive during the last 2 years. I guess it's 2 years that we're in, that EEC really spread its reach beyond the formal early education and care programs that we were trying to keep afloat, and really reach out to families who just did not or could not access it. So I just wanted to highlight some of those because it really shows the breadth of some of the work. So thank you.
I thank you for that. And I think that the things we saw our partners on the ground doing, and I think I will say I get the lovely vantage point of sitting with all of you and talking about the aggregate, but our team at EEC who were coming to me continuously saying, okay, this community thinks they can do this, can we support them? And just the opportunity to be able to fuel and foster that kind of creative thinking on the ground was just not only an honor to be able to be part of it from EEC, but I think even more so just as we look ahead, really emphasizes the remarkable nature of this field that is willing to pivot, roll their sleeves up and find things that we may not even see from our state level, and problem solve. And I think the partnership, Joni, that you brought up between our team at EEC and our partners on the ground to be able to in new ways come together and try to say, okay, if we had this, we could do this, and us scramble to try to find it, has been a really unique opportunity for our team here to think differently about our role in responding to the needs of the community in a way that bureaucracy doesn't always make very easy. But I see the dedication in our team at EEC all the time trying to navigate that, and it's been just ultimately so inspiring.
Thank you. Thanks.
Yeah. So talking quickly around the subsidy system, because again, as we think about what we have done and what we look ahead to do, I think this is incredibly important. We know that the subsidized childcare system plays a critical role for so many vulnerable families to access childcare. We also know that there were challenges in the subsidy system that we needed to account for immediately to be able to make sure that families had that support, regardless of whether they were able to attend every day or regardless of some of the challenges they may be facing themselves. So we were able to try to push some of the subsidy policies to eliminate barriers for families and programs. And I think that this has been not only really remarkable, but also provide us some data around ways that we might look forward and maintain and improve on some of the existing subsidy system. But I just want to remind again that that wasn't necessarily from the beginning the clearest path forward. Those first weeks and months, it was not clear what we did. We were able to, and the federal government has many regulations about how we do this. So we were in constant communication with them too to understand what we could or could not do with our subsidies. And so just to point out a couple of the things you won't read, but I think are some of the real tangible things we had to really figure out on the fly and were able to. Thank you to the magnificent team and our subsidy administrators that collaborated on what we needed to be able to achieve. Those first months, we were able to just pay based on enrollment. If you were enrolled in March 2020, we would pay you through the closure, assuming you were still enrolled in your program. That worked when we thought we were going to be closed for a few days, maybe a couple weeks. When it turned into months, that became very complicated to figure out how to reopen and verify enrollment so that we could meet federal regulations, which require we pay on enrollment or attendance and not and need to document every child. So we were able to work with our subsidy administrators to, instead of try to create all this paperwork challenge for families, is to allow them to get an affirmation that their family wanted to stay enrolled, even if they themselves weren't ready to start attending yet. Maybe their work was still remote, maybe their hours had changed. We had so many families that had lost jobs in those first months of being able to make sure that they were able to continue to maintain their access to childcare. We came up with an entire new system on the fly of confirming with the family that they still wanted to be there without creating a full re-enrollment process or some of the barriers that other states saw when they tried to follow the federal processes. And so really just impressed not only with our ability to create things with our subsidy administrators that allowed for us to continue paying for our families under the federal regulations. But again, that focus on how do we eliminate barriers for families, how do we maintain them, and how do we maintain the stability for programs so that they weren't forced into, trying to force families back into a program that may or may not be the right choice at the moment in the middle of a health crisis. We also, of course, were able to continue paying our parent fees and a lot of the other areas and policy accommodations that we were able to make. We also took that information, and as we made investments in our subsidy system, we're able to focus on those areas that were the most critical. Transportation, that we were seeing our subsidy reimbursement rates were so low that it was hard to even think about problem solving amidst so many challenges. And also things like our administrative rate that you all updated last time, knowing that that administrative add-on rate pays for a lot of mental health services or additional comprehensive services for families that are in more of need of that now than they've ever been. And so just focusing on not only the ways those early years, I think that are those early days of the last couple of years is as we think about where we are now and pivot to what we're looking forward to doing, I had to reflection over the holidays as we were responding to CDC updates and understanding around the supply chain of all of the things that we had learned along the way, and understanding the things that we needed. We have both been creating on the fly, sustaining, and are to focus on program and families, program stability and families. So obviously that folds into the infrastructure question too, which we'll talk a little bit more about at the second half of the meeting. So I won't spend too much time on that. But again, these were areas where we were negotiating investments from the federal and state government, really trying to, as quickly as possible, understand what are the gaps and how do we make it as easy as possible for people to access the dollars that would help them fit those gaps. That's not something, again, I love my job in bureaucracy. So when I say this, I don't see this as a fault, but the bureaucracy is not set up to pivot quickly in the middle of emergency. It's set up to stabilize and sustain large scale systems. And so our ability to be able to, for example, get an operational grant application up, start to finish in approximately 5 weeks, and get a system to get $160 million out the door in 6 weeks and over 6 months is unprecedented. And I think being able to learn from smaller scale things we got out with our workforce grants and our FCC grants earlier on, and really to focus and hear that feedback and implement it is something that we continue to be committed to, and want to make sure that, particularly as we look to the public comment and the feedback we're getting now, as people get nervous about where we are, just want to reiterate our continued commitment to listening, working, building things we know we need, but also understanding where those need to grow into stable systems that will help make sure that we have what we need to be able to do, not only in the moment, but sustainably over the course of recovery, which will be an ongoing process for both us and the field. So I wanted to just spend a little bit of time and be able to walk through some of that and really understand where and how this has evolved. I will, I think, and I want to talk, introduce Caitlin, who will talk a little bit about our current COVID response recovery and what we're doing now. But I say that, and I really wanted to spend some time looking through what we've done, because as I've reflected on the last couple of years, I recognize that right now it does feel a little bit deja vu. Like we're back in a system where we still don't know how long a surge will last. We still don't know how long parents will be nervous to come back. We have a number of different dynamics that are unknown. And I just wanted to spend a minute to talk through all of that uncertainty that we've navigated over the last couple of years, and all of those ways that we've worked together with the field to be where we are now, and how proud I am of the EEC team that's been able to really build this capacity, and how impressed I am with the field who's able to endure all of the uncertainty and patience with us, and knowing that as we look right now towards recovery, we are going to continue to rely on those systems. We're going to continue to rely on that learning and collaboration to make sure that we can be responsive and respond to a field that I know is grappling with so much uncertainty themselves on a day-to-day basis. So before I introduce Caitlin, I'll just offer if there's any other reactions or responses. I'm very happy to take them. But wanted to make sure we spent a moment reflecting on where we've come before we plow into where we are going.
Other questions, comments? Caitlin, great to see you.
Thank you, Madam Chair. It's nice to be here.
So I'm going to hand it over to Caitlin to talk a little bit about what our current response is. I know that I'll give a little bit of context for what Caitlin has been doing and what she's been charged with by the department, and then let her talk about how that's looked. So Caitlin has quickly taken, I know many of you got to spend time with her at the retreat, has quickly been able to step into a newly developed role in childcare operations that really is focused on building coherence and cohesion across the regional approach. So every regional office isn't on their own, but really thinking about how we build systems that help support across all childcare providers as well. And so as we've looked at the moment we are in time, obviously the testing strategy and our investment in tests has become a critical component and a critical learning of what we need to be able to keep childcare healthy and safe, the infrastructure healthy and safe and operational. And so that has been a critical component of what Caitlin's been charged with, is help figure out how and where is the appropriate investment and distribution of tests that matters for the types of providers that are engaged in our childcare system. I will just say that I have had so much fun over the last couple of years learning about molecular biology and chemistry of disinfectants and all of the things that we've had to learn. My mother will never forget the Mother's Day where I told her I had to go talk to a chemist about disinfectants and couldn't spend time with her. But I think it has been incredible benefit and asset to the department to have Caitlin on to help learn specifically about all of the testing strategies, the efficacy, and be able to have and have really enjoyed learning about it with her now as well. So with that, I will hand it over to Caitlin to talk about the systems that we're designing now.
Thank you, Commissioner and Chair. It's really great to have the opportunity to connect with the board again. And I want to thank all of you for your advocacy and help triaging so many of the public comments and the feedback that we've been receiving directly from the field. I'm going to refer to the slides that are in your briefing materials only because I tend to only communicate through deck. My husband oftentimes criticizes me that I'm unable to communicate if I don't have written materials that I'm sharing in advance. So I just want to acknowledge what the commissioner has said in that we are experiencing a surge. And so a lot of the guidance that we've provided directly to EEC staff and to our field more broadly is that we are reassuring them that this is a moment that is challenging for them. I myself, who am an educator, we take on so much of the role of supporting families. The criticism and always the pushback has been that teachers are not just teachers, they're social workers, they're nurses, they're family psychologists. Now we're being asked to become operational leaders, and I recognize that that can be very challenging, but EEC has really taken the approach of making sure programs have the tools and the resources to feel successful in navigating that new challenge. Slide 11 in your materials represents what we are seeing currently in terms of COVID incidents and how they're being reported to the Department of Early Education and Care and the Department of Public Health. A couple caveats around the data, because as you can imagine, data in the moment of a pandemic and most importantly a surge can be imperfect. And so what I want to acknowledge is that our programs under statute are required to report all COVID-related incidents that occur in their program. So whether that is a positive notification from a family, a child, or a staff member, or a household contact of one of those individuals, we are obligated to require those programs to submit written notification to the department of a positive incident and what the impact of that incident is within their program. Oftentimes what we do is we look at that data weekly, particularly in the moments of a surge, to better understand the challenges our programs are having, not just related to COVID closures due to a positive case, but due to staffing shortages and other complications that arise in the midst of a global pandemic. As you will see, as we have seen across all other industries, when we look at the data, there's a high increase of cases that are being reported by programs related to COVID incidences in the program. We have a daily touch point with the Department of Public Health. At this time, we're averaging around 800 incidents logged in LEAD, which is our online platform system, per day by program. That has significantly increased in the past 2 weeks. Monday, as you can imagine, is a big day for us. So typically that is a slightly larger number than what we see on average day to day. But it has appeared to plateau within the last week. We're seeing on average 800 cases reported through LEAD. And then this is also inclusive of a lot of the reporting that's done directly to the local boards of health as well. The work that we do with the Department of Public Health is to really aggregate trends and to determine opportunities to better provide support to our programs. One of the most immediate opportunities that we saw to provide better supports was to develop protocols and enhance our PPE distribution to programs across the state. And so I just want to kind of take a victory lap and to talk about our programs and their ability to raise to us and escalate the need for additional resources and supports to operate. A lot of folks will communicate to us directly. You know, there was not a need for us to introduce public health guidance or public health requirements within private business. This was an opportunity for us to give programs the resources and the tools they so desperately needed to remain open. And so the operating materials and the protocols that we've released have really been well received to date by the programs. The intent of those materials was to reduce their dependency on local boards of health and the Department of Public Health so that they could independently operate as businesses and understand the public health guidance and science that will enable them to continue serving children in person every single day. Protocols, PPE guidance does not go without a lot of questions. And so what I tell our licensors every single day is that as we produce more guidance and more tools, there will be more questions. And we continue to do this because it is the right thing to do, not because it's easy, but because it is our job and it is the right thing to do. I am a parent in addition to being a state administrator. I wake up every single morning, hold my breath, and look at my phone and hope that my kids have a childcare place to go to during the day. So I recognize how important it is that we provide those supports to our programs, our educators, and to our families so that they can begin to independently navigate this guidance and make decisions that benefit their family, their businesses, in the way that we know that they know how to do best. So slide 12 really talks about the COVID-19 mitigation layers. And I want to just emphasize that these aren't new mitigation layers. We are really just augmenting and supporting and enhancing those existing layers by offering and layering additional resources and support. So the PPE distribution has been something that really has been taken, you know, I think about just nationally, there are not a lot of states that are providing monthly orders of distribution of PPE to programs in order to operate. This is a tremendous resource and an incredible opportunity to pilot bulk purchase ordering for our smaller programs. Effective February and based on the orders that they'll complete in January, we've added KN95 masks to that distribution so that programs can begin to supplement their PPE supply with some of what we know to be most important for their operations. The pool testing program that is offered by Neighborhood Villages, that has rapidly expanded. It's an asymptomatic surveillance testing program that supports children over the age of 3 and staff in routine weekly asymptomatic testing. It is one of our testing strategies that we currently leverage in our EEC license programs, and we will continue to refine and reflect on that program design to offer more supports to programs. We have 8 dedicated PCR COVID-19 mobile sites across the Commonwealth. Those are strategically placed. These are separate than the broader Commonwealth testing sites. These were strategically placed in mind and worked, and we partnered with legislators to identify pockets and communities where we knew there to be the highest need from both our programs, our educators, and our families for PCR COVID-19 testing. As I'll state in a little bit, we are working tirelessly to expand the operating hours, as is the Commonwealth and the nation, for all testing sites. We recognize that utilization has significantly increased. And so part of moving towards a higher operating schedule is staffing, building out supply, and then working with our vendors to make sure that we can reliably offer more hours in a way that is in good customer service to the educators and families who depend on these services. Our mask policy, as the Secretary and Commissioner referenced, is still a requirement. And so that is an added mitigation layer that we are enforcing across our programs. And then the development of the protocols. So many of you have seen the announcement and have seen the post on the protocols. This was something that was developed as a cross-agency collaboration among EEC, the Department of Public Health, the Executive Office of Human Services, our Executive Office of Education, Governor's Office. There were a lot of minds and hearts that went into the development of that guidance. We've also made a commitment to collecting feedback on the protocols and the guidelines so that if there's an opportunity to further clarify some of the guidance, we can either provide updated information in a new protocols document or release a frequently asked question material or resource for programs. So we are really hopeful that this will give programs the tools and the resources they need to operate and consider and reliably offer in-person services to families each and every day. Slide 13, as I referenced earlier, is just a deeper dive into the test utilization that we're seeing across our dedicated EEC mobile sites. I'm not aware of any other state whose Department of Early Education and Care has dedicated resources to its own PCR testing sites. This is a remarkable commitment from the Commissioner and the Secretary that is worth noting. And so while we work to increase operating hours and operating schedule, learning a lot about supply chain, manufacturing, distribution, as we work towards that, I think there are some immediate and really remarkable victories that we've been able to accomplish with those testing sites. Beginning as early as the week of January 18th, 3 of our most busy sites, Tewksbury, Braintree, and Swansea, will begin operating 7 days a week with an increased operating schedule by about more than 20 hours per week. We are still averaging a PCR turnaround result time of less than 48 hours, which is remarkable considering a lot of the turnaround times that we're seeing just broadly across the nation. We will also be looking to add additional lanes of access within all of the testing sites so that we can serve more educators and do so more timely. Just anecdotally, we know that people are waiting in line, as is everyone, for COVID tests. And so working really diligently with the vendor to build out thoughtful but strategic opportunities for expansion has been top of mind for both the Commissioner and myself. Slide 14 really just again details the pool testing program with Neighborhood Villages. It's a first of its kind for childcare programs. There has been a lot of great work, particularly within the Commonwealth at DESE, to provide asymptomatic surveillance testing for programs. Childcare, this is really a first and only one of its kind for childcare across the nation. And so Neighborhood Villages has really been a leader in partnering with EEC to develop this program design for childcare programs. Prior to the surge, they had 270 programs enrolled in the pool testing program, serving about 8,000 individuals weekly. We thought this was remarkable, and then we announced the availability or the commitment of availability of rapid antigen tests for childcare programs. Since then, we've seen 3,000 programs opt in to testing with Neighborhood Villages as an infrastructure for supporting COVID mitigation. There is equal distribution of those 3,000 programs across family childcare and group and school age programs, which is remarkable. Our family child educators have asked for help. They want robust asymptomatic surveillance testing in their program. They want resources. They want to be able to continue operating as businesses and as providers, which is an incredible and remarkable strength of our system as a Commonwealth. With those 3,000 programs that have opted in, we're looking at about 26,000 staff that would get served and 94,500 children. So that moves us into the rapid antigen test program that we are looking to build. And there's 2 components to the use of rapid antigen tests for childcare programs. And the Commissioner will speak to this as well, but this is very specific and very concrete what we need to deliver for childcare programs. These are private childcare businesses that have repeatedly asked for protocols to enable their own guidance, their own supports for leveraging testing within their program. And so our responsibility is to provide those guardrails, to provide that guidance so that they can independently operate with the right support, the right infrastructure, and the right supply, a robust testing program to support children who come to care each and every day. Rapid antigen tests, right now, Neighborhood Villages has been distributing those. They actually did us quite a hat trick. They distributed 32,000 rapid antigen tests within 3 days to 270 of our programs. That was during a disruption in our federal testing program in November. It was a pilot for us to really leverage and see how we can distribute rapid antigen tests for the purposes of symptomatic surveillance, symptomatic testing and asymptomatic surveillance testing. More broadly, now in January, we're working to distribute more than 40,000 tests. We did this in concert with DESE's plan to provide testing to educators who were returning after the holidays and felt reassurance with knowing they would have access to rapid antigen tests for asymptomatic testing in order to return safely to care. We are using both of these models as a blueprint for what will be a more robust rapid antigen testing strategy for childcare programs in the future. We are actively working with both federal partners and neighborhood villages to develop protocols that will support programs who both independently want to procure rapid antigen tests, but also those who want to leverage our infrastructure with neighborhood villages to receive training, support, protocols, resources to administer rapid antigen tests to children and staff routinely to provide continued in-person care for children who need it the most. So we will be working over the next few weeks to finalize the guidance and details of these documents. As you can imagine, I joke all the time, the two hardest things to do in state government, and I say this having worked in it for 4 years, so there might be other hard things, is buying something and hiring someone. And so when you build a testing program in a matter of weeks, you are tested on those very two fundamental challenges. And so while it has been an enormous undertaking, we know it to be the most important strategy for supporting in-person care. And we are really excited to partner with our field, neighborhood villages, and our public health experts in administering this program.
Thank you. Thank you so much, Caitlin, and for all of the detail. I wanted to just highlight a couple of things, follow up a couple of things that Caitlin said, and then turn it open for questions. One, as she noted, we do know that there are a number of questions coming in about the protocols, and I will reiterate, if any of you or if anyone who is listening at home, we are collecting those through the Commissioner's Office inbox, and we'll be putting out an FAQ. So please, if there are questions that are unanswered, as Caitlin referenced, we will continue to refine and put that out as we get feedback, as has been our MO over the last couple of years. I also just wanted to reiterate, I think, what Caitlin pointed to in terms of the test distribution. We have a few components that we have modeled and tested, and are really anxious to be able to look at offering at a larger scale. I will say that it is very clear, I think, in harkening on the themes of the last couple of years, it is very clear that testing strategies will be critical to integrate to all operational strategies in childcare to be able to maintain safe, healthy operations over the next year. And so ensuring that the pooled testing, the asymptomatic surveillance testing, particularly when we aren't in a surge, is something that our providers engage in, get comfortable with, and understand is a huge resource. We were the first state in the country to offer anything of this sort, and are certainly the only state in the country offering it at this scale. And so really eager to make sure that that continues to be seen as we look to the antigen test distribution, to the statewide acquisition of tests that we'll be able to distribute to childcare through this program, but knowing that this is going to take a multi-pronged strategy over the next next year, and want the next couple of months to make sure that people are not just focusing on how do I get access to what I need right now, but how do I learn from that with EEC and make sure that we are leveraging that learning to sustain, to integrate sustained testing and maintain operations as we look at the cycle of the pandemic moving forward. So with that, I will open it up and see if anyone has any questions or comments.
Caitlin, thanks for the update. It was really comprehensive. Questions or comments from folks? Paul.
I just want to comment, still fairly new to the board here, but just want to send my thanks, Commissioner, to you and your team for all of the work that you've done. And also thanks to the field. I know, Joni, you mentioned a couple of creative, innovative partnerships and everyone chipping in. And also just to recognize that I know from each one of our seats, we hear from providers every single day. This is all incredible, great work, but it doesn't solve the daily transportation issues or closures of classrooms and the trickle down effect of that may have on the workforce and people's jobs. And so I just want to make sure that everyone's aware of, while there's a tremendous good work happening, we all understand that it is not solving everything in solving the daily vulnerabilities that a lot of providers are experiencing, but yet we're listening and we're trying to get there as best we can. While, Commissioner, I hear all the partners that you talk about, the CDC, the federal government, the state government, the local boards of health. Like, this is complicated in a very complicated delivery system that we operate in. And so kudos to the field and to your team for trying and working so hard to be creative and innovative during a time in an industry that it's very difficult to do so. And so I just feel the need to comment on that as I listen to Caitlin, your presentation and the work that you're doing on a daily basis. But the levers that have been pulled since day one in March of 2020, when this started, that timeline that you shared with us is mightily impressive. But again, there's still a lot of work to be done for our folks that are in the field every single day, and just want to acknowledge that.
Yeah, I so appreciate that. And I think this is really, as we look to the second agenda item, is exactly one of the challenges that we have ahead, is that while we are responding to the urgent needs of the health crisis, we still are functioning on those urgent needs in a very fragile field that was, prior to a pandemic, had a lot of vulnerabilities as a sector. And while we have recognized the critical nature of this infrastructure through the pandemic, I think what that doesn't do, Paul, to your point, is necessarily fix all those long-standing gaps in what we need as a field. And I think that this is the opportunity we hopefully have in front of us, is to try to transition some of our urgent response also into some of that law that addressing the long-standing infrastructure needs. And I cannot appreciate more the day-to-day challenges that were already standing in the childcare infrastructure prior to the pandemic, and how much that becomes more difficult with the uncertainty of the landscape right now.
Thank you.
Yeah, I appreciate it.
Carolyn, go ahead.
I just want to echo what Paul said, but also to just say thank you, and absolutely an outstanding job, Commissioner, by you and your team. I mean, I know how incredibly challenging and complicated it's been for 20 plus months at this point. And, I think that as much as we talked about a strategic plan and moving forward, that the world has had a different plan in mind. And so I thank you and your team for being incredibly responsive to the needs of families, to the needs of the field, and in a way that was completely unpredictable in terms of the needs, in terms of the timeline. I mean, I think we all were very grateful a few months ago when things seemed to be going in a different direction. And now here we are again with a surge. So, we'll get there. It might just, things might take a little longer than we had originally anticipated in terms of making those long-term changes. But just even being able to sustain the field at any level has really been an incredible achievement. So thank you again, Commissioner, to you and your team. And know that we all appreciate you very much, and we're here to support you in whatever way we possibly can. Thanks.
Thank you. And thank you for all the support. It has been, it was certainly not exactly the path I thought when we first had a conversation about this role, but I think a remarkable learning experience for all of us. And to your point of being able to address not only the urgent needs, but also learn where we need to go going forward.
Any other comments, questions on the COVID response and strategy today going forward? So, sorry, go ahead.
Madam Chair, just one thing. I wanted to just clarify. I know that there have been a number of questions, so not relevant to necessarily delve deep, but a number of questions that have come around that COVID reporting to EEC and DPH, and that has come up a lot. It is, as Caitlin pointed out, it is in statute that DPH has to report on individual COVID cases in childcare, which is why some of the requirements to report through our lead portal to DPH is there. We are working with DPH with our partners in the legislature to see what can be done, because we know that that individual reporting is a burden. From EEC's standpoint, we require, just as you would with any transmissible disease, that if something happens in your center, that closes your center, that changes the operations, where a family has to be home, it's an incident report, the same as if it were any other transmissible disease for us. We don't need individual reporting, but we will clarify that in an FAQ. And again, are working to see if we can alleviate some of the burden, but it is a statutory requirement that we are responding to.
Great. So why don't I? Oh, go ahead,
Madam
Paul.
Chair, can I
Yes,
just ask
of course.
Caitlin, can I just ask you a question? If you're a provider on this call and listen to the work that Neighborhood Villages is doing and the tests, and you're thinking to yourself, I'm not seeing this, right? Like, how do I participate in this? Can you just point people maybe through this venue in the right direction on how to make sure they're leveraging all the resources that are available?
Yeah, absolutely. So every program has a login within their lead platform. And so first and foremost, we have about 5,000 programs accessing the PPE distribution every month. We have more than 7,000 programs that are licensed by EEC. So I would encourage everyone to reach out or work in their lead portal to start requesting the PPE distributions monthly if they need access and need immediate support. With regards to the testing strategies, Neighborhood Villages is accepting new enrollments and has been. They're averaging about 1 per minute. So I want to answer your question a little bit differently too. I also want to say, absolutely enroll with Neighborhood Villages. Absolutely stay on top of us to do the right thing for our programs, but please be patient, because we are building this in direct response to an emerging need, and that requires a lot of refinement. It is most important that we do this right, then we roll out something that is not going to be effective for programs and families. So I think everyone has the right intentions with providing feedback on the program design, but I also want people to be patient with the people and the folks that are doing this work every single day, because they care so deeply about this work, and it can feel personal, even though it's not, to get feedback directly on the outreach specific to the operations. So absolutely, I would also encourage everyone to have access to the field emails that come out of the commissioner's inbox. We provide routine updates on COVID mitigation resources and strategies. I always encourage people to reach out directly to me as well. And I am always happy to present or share with folks if there's a need for a smaller audience or sort of work, in smaller groups to better understand the resources that are available.
And there is a link in the board materials to sign up for Neighborhood Villages. As Caitlin said, for programs, they're in their lead portal. It has a lot of details and links to be able to access these, but also in the materials, there is a link specifically to sign up for Neighborhood Villages.
Caitlin, thank you. Great messaging and really good concrete today. Like, what could you do today? All right, I'm going to suggest we take a 10-minute break. We'll gather just a little before 2:30 Eastern, and we'll start again. Thank you. Okay, welcome back. And we'll turn now to our second agenda item, which is obviously deeply intertwined, coupled with the first one, which is how do we continue to turn a lens to even more support for such a dedicated and resilient workforce who have worked in so many ways in unrelenting circumstances and doing what was already a very difficult job pre-pandemic. So we'll turn now to this continued conversation about the way we support the infrastructure for operating childcare, early education and care, and also some direct support for workforce.
Thank you so much. And I am going to introduce Jocelyn Bound, who will talk more about the specific evaluation of our C3 formula, the investments, and our thinking moving forward. I wanted to highlight just a couple operational components before I do that. One, that reminding you all that earlier in, well, I guess later in 2021, we did announce the extension of the C3 operational grants January through June. Those are up for recertification now. So anyone who had been getting grants can go ahead and just normally recertify their information, continue to affirm that their information is accurate in order to get the January payment. For new programs who weren't eligible due to the date restrictions in the ARPA funding, we are in the process of adjusting the technology to allow programs who were not previously eligible to apply, and an email will go out as soon as that technology is ready, and those applications can be accepted. Those who were licensed or approved by EEC past the March 11th date that the first round of funding had established. And so just to highlight that we continue to move on in this, I also just want to acknowledge that some of the conversations we had around a bonus structure for the grants March through June are impacted by the operational considerations of the surge right now. We have had the educator professional registry. The technology is ready to launch, but knowing the burdens on our programs right now, we've decided to hold off on that for a few weeks to make sure that people have the focus and the ability to hear the training, and which I know is just overwhelming right now. So because of that, there are some adjustments and modifications to the bonus structure that we've been making to make sure that we can still offer the intention and of additional dollars for those who have effectively invested in their workforce to retain or recruit staff, but also with the balance of the fact that we are in the middle of a surge that will that is consuming people's energy, and wanting to be thoughtful about what that impact would be over the next few months as we continue through the recovery. So with that, we are learning from that, and Jocelyn will talk a little bit about our process that we intend to look to go through going forward based on the recommendations of third sector capital partners who we've been working with, but know that we are very much, and as started within the meeting, real time trying to make adjustments that allow for us to continue in the rebuilding and the distribution without overburdening our programs with administrative requirements. And with that, I'll hand it over to Jocelyn.
Thank you very much, Commissioner. I'm happy to be back talking about the operational grants again, and I'm going to begin by just reviewing some of our grant metrics around participation, and then we'll dig into some additional field engagement and analysis that we've done in thinking about what the bonus structure might look like. So as the Commissioner mentioned, programs that have been receiving the grant continue to apply for grant funding and recertify into January. At this point, we have a little over 80% of our of those that have been eligible applying for and benefiting from the grants, with an estimated expected expenditure of around $200 million by the end of January. So we are seeing increased participation and significant investments in programs across the board. You have details about the participation rates of different types of programs in your board slides, 17 through 20, slide 17 through 21. I'm not going to go through every single slide. This is updated information that is very similar to information that you've looked at in the past, but it does continue to show that participation rates are higher for programs serving subsidized children, programs in higher SVI communities, and the grant awards are also higher for those groups of programs. And additionally, we continue to see that programs serving infants and toddlers are also receiving larger grant awards, which I think, again, is just reconfirming that the formula is functioning as we hoped it would function and continues to do. And the grant continues to reach the providers that we are most concerned about making sure are availing themselves of this opportunity. On slide 22, there is a recap of the conversation that we had about the operational bonuses, the workforce bonuses that we're looking to put in place in the spring. So just as a reminder, the goal of these bonuses is to support programs in retaining long-term existing workforce and recruit new educators, as well as support professionalization by making meaningful expansion and staff benefit structures. And for FCCs, we also want to recognize that they programs that substantially increase the family-facing services that they provide. So thinking about things like the hours of operations, the extent to which they can provide infant toddler care, and other offerings to support families that they provide through their business, that is very much of a primary focus of that part of our field. To get a little more information and to get some feedback from the field and thinking about the nitty-gritty of how this bonus structure would be put into place, we did engage with the field in a webinar right after the board meeting last month, and then posted surveys for center-based programs and for FCC educators to provide us with feedback to questions that are targeted to some of the issues we were considering and some of the information we were hoping to get more information from the field about in thinking about how to structure the bonuses. And we have to date, they're still available, and we have to date received responses from roughly 130 center-based providers and roughly 130 FCC educators as well. Our partners at Third Sector were provided with this data, as well as continued data from the application and the survey that providers submitted in November when recertifying, and proceeded to move through some analysis to help us understand where the field is around some of the metrics we were considering, and also what some of the recommendations and thoughts the field was providing us in thinking about how we might structure the bonus payments, as well as, you know, the larger issue of the workforce challenges that they're facing and how we might support it. From center-based providers, I think the high-level message is continued confirmation that they struggle to recruit and retain qualified staff, and that they would like more support in recruiting high-quality educators. That this pipeline issue is very much a piece of the larger picture, and that is something the commissioner will talk about in the next component of the presentation. I'm going to focus in on some of the things that providers are telling us about what they're experiencing in their programs and some of the actions that they're taking and recommendations that they had for us. If you look at slide 24, you can see the types of challenges that providers are reporting that they're facing in retaining educators. So this is the outflow that they're seeing. Where are they seeing educators that leave their programs go? And largely it's leaving the early education workforce. The majority of providers, the most providers reported that educators were leaving for jobs outside of education entirely. The next most common answer was that providers are leaving the workforce entirely, or that they're moving to public schools. And movement within programs was a much smaller percentage of concerns for the field. On slide 25, you can see some of the challenges that providers are facing in hiring. And I think, you know, this just repeats things that we've been hearing from the field, but they really are having a very, very hard time finding qualified educators. Qualified educators are not showing up. When they do show up, they don't show up consistently and follow through on the hiring process. And if they do, they're asking for salaries that are above and beyond what providers feel that they can pay. So again, that challenge in bringing qualified educators in is a big piece of this puzzle for programs. But when you do look at slide 26, you can see some of the ways programs are reporting that they are trying to respond to this challenge of recruiting, and the actions that they are currently taking to recruit more educators. First of all, the dominant response was that increasing salaries is a critical component of their efforts to recruit new educators. In addition, professional growth supports as well as benefits, which include, your standard benefits, but also other types of benefits like supporting educators, continued education, providing flexible schedules, reduced cost childcare. So there are a number of different types of benefits that programs are considering in their efforts to recruit quality educators. If you look at slide 29, you can see some of the responses that the programs have given around how they are retaining educators. And in this particular slide, you can see the responses were broken down across different types of providers. So the dark blue is the all provider responses, but then the teal bar shows the providers that are reporting they do not have enough staff to meet their potential enrollment in their programs, while the light blue bar are programs that are reporting that they do have enough staff to serve their full enrollment. And I mean, first of all, just call out that again, increasing salaries is the most common response across all providers. Interestingly, in this case, bonuses and stipends, which are not highly thought of in recruiting new educators, are a particularly important technique that programs are reporting. And then other types of benefits as discussed, like flexible schedules, professional growth opportunities, and support for their education. So both the professional supports as well as supports for them in meeting their job requirements within the context of the challenges that they're facing. And again, I think what's interesting is to look at those different groups. I will call out that, we can't make causal conclusions from this data, but it is interesting to note that the providers that do report having sufficient staffing are also providing more of these different types of strategies across the board. And then if you go to slide 30, we can dig a little further into how providers are increasing salaries and what that means for an educator and how educators might achieve a higher salary over time and the current salary structures of these programs. In general, the same numbers of providers are providing regular cost of living increases, and you can achieve a higher salary as an educator by moving into a different position where that position has a higher salary. So you can move from an assistant teacher to a lead teacher position and gain a higher salary from that. I mean, I know anecdotally I've heard, and this makes sense from the field, that that is very dependent on those positions opening up, and you as an educator being able to take the steps in the interim that you've been able to take to qualify yourself for that position. What is interesting again here is that those that are reporting that they have sufficient educators are also providing other opportunities for salary increases above and beyond cost of living. So they either have a regular structure of increases above and beyond cost of living built into their salary structure, or they have an option of providing increases at the discretion of somebody in the program. So across the board, what we're hearing, and you also have some anecdotal and qualitative responses in your slides, but educators are saying that they do want to commit to consistent and sustainable increases in salary structures in their programs as a way to address the challenges that they're facing around retention and recruitment. And they also are interested in having opportunities to pay higher qualified educators more. When they think about benchmarks, they note that the pay of public school teachers is a goal that they would like to achieve. But across the board, I think there is commitment to the field and a recognition of the importance of these types of strategies in the retention and recruitment of educators. When thinking about family childcare providers, so this is on slide 33, they also do want their qualifications and their education and the professional engagement, learning engagements that they've done to be recognized in the ways in which they are compensated themselves, as well as noting that there are some particular family-focused services that they provide that feel important to recognize in thinking about compensation. So the ways in which, the extent to which they serve infants and toddlers, and the types of comprehensive supports that they provide to families being the most popular. But you can see here, there's also a range of ways in which the FCC educators work with families and support families to be considered. I'm going to pause. Are there any questions so far before I get into the recommendations?
Jocelyn, can I jump in and just as you know, I think of highlight something I think that contextualizes throughout the data that Jocelyn showed that kind of links together some of our recommendations from third sector and the next section as we talk about a workforce pipeline. As we talked about throughout the strategic planning process, the interconnectedness between the program's operational funding and their ability to set and invest in their educators and the global pipeline of qualified educators available to hire is complex and completely interdependent in ways that we need to try to invest simultaneously in programs' capacity to pay, compensate, think about a business model that pays a livable, reasonable wage, and also the ability for them to find and recruit talent from a variety of types of preparation programs is interdependent here. And so I really felt strongly, and I think, Madam Chair, as you pointed out in introing this section and your earlier comments, is that we cannot try to talk about investments in programs without talking about the investment in the pipeline. And the investment in the pipeline is really difficult to discuss if you're not also simultaneously talking about where that pipeline might end up being employed and what that employment looks like. And so I just highlight, as Jocelyn talks through the next section, is that the data has to be interdependent to really, I think, make the transformational impact we're hoping to have with these types of strategies in the field.
Well, and the pipeline, you know, and we also need to circle back to these conversations at the same time, acknowledge the multiple pathway, like that a pipeline is not, you know, simply a teacher preparation program, if you will, which is an excellent one way, but that can't service the mixed delivery field that we want to thrive, right? So we also want to muddy it up that way in a good way.
And I think exactly, and I think that part of the challenge ahead is to redefine what we mean as the stages of preparation to have a highly trained, highly competent workforce in this field and access to that. And I think that's part of our challenge as a group ahead as well that we'll talk about next. But as Jocelyn goes deeper into the ways we might think about trying to set the stage with programs around influencing an incentive structure, it really is interdependent with that. And I think this data really calls that out strongly.
Yeah, and what is it that we mean by pipeline? And I think that's a TBD in a lot of ways, but it's emerging.
Thank you. Yes, those are all really important thoughts. And I think just moving ahead to slide 34 and 35, where we look at what is it that we want to, you know, sort of what are some of the details of what we would want to accomplish at this moment in time with this bonus structure, and then what are some of the long-term goals in the broader picture of how we're thinking about setting up programs to be strong employers in the context of a system where we're also supporting the building of the pipeline and ensuring that, you know, there are people coming to them as they, you know, are also addressing some of these tactics to serve as strong employers. So on slide 34, I think we acknowledge that we have to accommodate the current challenges that the field is facing right now. And, you know, sort of the myriad of business models and starting places the programs are coming to some of these questions with, while also thinking about how what we do fits into a long-term plan to move towards retention and recruitment metrics that we can use in a variety of ways in terms of thinking about how we're working with the field. So the recommendations here in sort of what we might be thinking about for both center-based and FCCs. But as a starting place and a short-term goal, we'd really like to hear from programs what they are doing and how they are able to address some of the persistent recruitment and retention challenges in the ways that are individual to the program, to the needs of the programs, the capacities of the program, the community that they're serving. So that we're giving programs flexibility and thinking about the strategies that they use that we would support. But at the same time, we're gathering information from them about, you know, what is the investment that they're making, so we can start to understand the range of investments, both in their existing workforce. So, you know, thinking about all the things we talked about, the salaries, the benefits, increased salary increases, and starting to get a handle on some of the retention metrics, while also looking at the ways in which they are supporting a new workforce. And then in the long term, we can think about starting to develop from that information ongoing metrics of success around what would we expect around an annual turnover of educators. What's the average turnover of average tenure of educators at a particular program, and also thinking about tenure at a program versus tenure in the field. The salary and benefits increases that we see over time, and the number of new educators that programs are hiring, to start thinking about and understanding how we might benchmark some of these pieces, as well as understanding where are there the most effective practices that we would want to draw attention to and support. On the FCC side, I mean, some of these are similar in that FCCs can also respond and provide us with information about how they are supporting both themselves as an FCC educator, but also their assistants with salaries and benefits, but also sharing information about the types of enhancements to their business models, and both in terms of quality, but also their family supportive activities, with a goal of similarly getting a larger sense of where the field is and developing metrics for success around those types of actions that FCCs can take. And then on slide 35, we have the recommendations that came from third sector and their analysis. So based on the current feedback that we've gotten from the field, the recommendation is to start in FY22 using self-report on the investments that current C3 grantees are making in the actions that they feel will support recruitment and retention in their workforce. And this will allow us to gather baseline information while also rewarding programs for the efforts that they are taking during this fiscal year to develop effective strategies that are unique to them and their needs and their communities. So in thinking about the types of data that programs could report on, and we will continue to develop these specifics as we get closer to the spring. But certainly for all types of programs, center-based and FCC, a piece of this would be continued grant reporting, as well as participation in the workforce registry once that is launched, because that will give us a tool whereby we can get individual level information about salaries, about tenure at a particular program and tenure over time at different programs, and provide some really critical data points in this work. But additionally, it will be important to get information about the types of raises and bonuses that programs are providing, the ways in which they're improving benefits for their employees and for all employees, not just that some benefits are offered to some, but what benefits are consistently available to everyone. The types of professional supports being provided. As we gather this information, we will also be thinking about the type of documentation that we will need from programs to understand and sort of understand and confirm some of these pieces, including things like budgets, tax documentation, enrollment reporting, and potential, sort of something to help us understand revenue. On the family childcare side, again, I think it's a similar type of reporting, but what we do want to understand are the ways in which the wages of both the educator and licensee, as well as any assistants, are gaining, benefits that are available. Investments in quality improvement, such as ongoing education and professional learning on site, as well as the types of family responsive strategies. So are programs increasing their hours? Are they building their focus on infants and toddlers because that's responsive to a need that they're seeing? The types of characteristics that we've been discussing. And similarly, we'll look at the type of documentation that we will need as part of that process as well. Pause there for any questions on this.
Questions from anyone?
Just to highlight, as Jocelyn was saying, I think the big recommendation that we are taking to heart on some of this from third sector is that while we were looking to have some empirical data points to be able to measure a bonus structure on, what we're hearing back from the field, what we're hearing back from third sector is that given the wide-ranging starting points of the field in terms of making these investments and operationalizing some of the funding to date, our challenge is allowing us to have more flexibility on that data metric we'd be using to qualify for the bonus, and more emphasis on getting a deeper analysis of how the money was spent that could help us ensure that an objective was met, but really that we were setting the long-term understanding of where we could really impactfully start to look at a baseline and move forward. So trying to balance the reality of the field with the needs of the system to be able to build and grow.
Comments, questions? Jamila, this is definitely up your alley. I'm sort of struck by how much data there is, and yet if we could like double and triple those sample sizes, we'd have a better sense, right, Jocelyn? Like there's so much, but it's so spread out that it's almost hard to know how to work with it. But really interesting, and thank you.
Well, thank you. It's been a pleasure to be able to share and discuss this with you.
Good, we'll stay tuned.
Okay.
Thank you.
Excellent. So moving from that, obviously, again, one of the things we really wanted to emphasize as we were investing in our programs is the impact that was having on recruitment and retention, but recognizing, as Madam Chair said earlier in the conversation, that the pipeline, as we've been talking about for months, there is not a tight pipeline into this workforce, also into programs. And so really making sure that we try to make those comparable investments in the pipeline, as well as our programs to be able to receive and employ educators, has been a critical component of our work. So I will not read through all of the detail of the updates, because a lot of these stem from conversations we've been having, but I just wanted to highlight from some of the big components. So as we talked about in the fall, the multi-pronged approach to really thinking about a workforce, I think to Chair Lasso's point, of really thinking about a multi-pronged investment into the components of the system currently that could help build a tighter pipeline, less leaky pipeline for us. Really thinking about the access to higher education, knowing that the population that is largely staffing and working in childcare programs are populations that have historically not had as easy access to higher education as we would expect, as we would like to expect the kind of of degree-based approach to qualifications, and that's a challenge for us. And even as we've then looked at trying to expand access, we find that we're confronting, and I think this is a national problem, I commiserate with a lot of my colleagues nationally about, is that we find that we have a reality of the field of many of our workforce that has taken a smattering of courses over time, or has engaged in one requirement that hasn't felt like it was leading to the kind of articulation of an AA or a BA that would feel cohesive. And so I think that's one area that we're really working on bringing together, not only higher education, but also understanding how we expand access to higher education for this specific population that we're interested in recruiting and retaining in this infrastructure. But then also really thinking about building the credential that would help articulate how we add individual competencies and courses up to a professional licensure. So both leveraging higher education, but also looking at our role as the Department of Early Education and Care, not only as partnering with higher education, but also driving the professional competency metric that we would use to be able to qualify people for working in this specific area of the sector. DESE has a teacher licensure that they use to qualify people to work in school districts, and for EEC, it has been pieces depending on the role, but not necessarily a professional licensure system that would help articulate a graduated ladder that people could climb in the profession. And so that's something obviously we've talked with you about and are working about, and obviously our work with employers to help think about compensation. You just heard about a lot of that. But one of the really big challenges we also have is how we talk about entry into the field. In Massachusetts, to work in childcare, there's some very minimal requirements to start. Child growth and development course and the federal requirements on health and safety protocols. Of course, we want people to have additional competency. We want to help build that really robust kind of skill set that it takes to really do the work that we know of working with children and fostering the kind of growth and development and learning that we expect to be happening within our programs. But we also know that in order to do so, we need to help those individuals navigate the right kind of preparatory programs that would help build that. So we have launched a number of really great things and a few updates in this. I think one of the things I really want to highlight is the Professional Pathways program that we launched in the fall in November. I think we talked with you all about this as helping fill a navigation role for people interested in entering the field, helping them find, if I am interested in coming in and I need child growth and development, if I'm calling all the community colleges to find out who has my schedule, it's pretty quick that I might burn out on that and then choose, as you see in the data, opt into another field. What we want is the one phone call that can help navigate multiple different systems to find the right coursework that works for you, whether that is higher ed, whether it is an alternative, whether there are a number of different ways that we can that we could look at this. And so we have been working with neighborhood villages to create a professional pathways website and process. They've hired on some coaches to help individuals. You see the numbers in here that we have already had great interest. And I've heard back from the community colleges that it's really been helpful for them because it's helped them partner with interested students in a more cohesive way. We are really eager to help leverage this to work more with now entities like the Mass Hire boards and the career coaches so that they understand how, if they have an interested candidate, there's a one-stop shop to make a phone call and understand how they can get connected. And knowing that that also has to translate into some job boards and some connections with programs who then become the employers, given our the flexibility we've offered in the new hire policies that we put out as well. You also see, we hope that this will continue to enhance our community college enrollment as well, and help develop cohorts for those individuals who may not be able to access community college coursework individually very easily, but may be at a location where there's a few people there's enough to build a cohort where the course instructor can actually come to them, as opposed to having individuals go to the course instructor as well. And so eager to continue to build those out. One of the things and you have all of the details there of some of these initiatives that we've looked, a lot of the strategies that we've really tried to employ and the success metrics we've been able to see to date. But one of the things that we've really recognized, and I think that this came, I will allow Chair Lasso to talk a little bit about her experience as well as we designed some of the conversations with the board over the last few months. One of the things we've recognized is that we aren't all working from some of the same conversation around what a competency-based approach to training would look like, and how you measure that. I think what we have tried to do in some of our workforce policies is focus more on empowering our program directors to recognize the competency that they have to depend on every day to serve and to care for their children. But we recognize that we're not all working from the same definition. And so while we've tried to put some of these in place, I've also had a number of conversations with different pilot type programs across the state and in other states that have been looking to try to build the pipeline in their communities. And one of the things that has been a constant challenge is what do we mean by competency? How are we defining a competency-based approach? Many of the competency-based approaches that I have engaged with use strategies like reflective supervision to help understand a reflective practice around observing and then conversing around your practice in the classroom. I think that we would benefit from things like a common framework, a common tool, understanding where and how we can appropriately prioritize the components of a competency-based approach as we're looking at pilots, and differentiate a competency-based training program from a reflective supervision that you may have, or a lead teacher mentor program that you may have in an individual program to help support new workforce. There's a difference between what we're talking about a competency-based training and good practice to support workforce in a program that we really struggle with as we're talking about recruiting a new workforce into the field, building programs, and then sustaining and retaining them and growing them in their competency and skill set to be able to have an impact with children and families. The other thing I think we struggle with, and I think looking at the Pragia presentation earlier in the year, or earlier in the fiscal year, I guess the end of last year, earlier fiscal year, that we talked about are some of the ways we measure the achieved competency. I think that this is a really hard thing in our field, particularly when you're not talking about, something, when you're talking about a trade, for example, and you can look at accomplishing a demonstration project that is completed. It's very difficult to look at a demonstration project of a 3 or 4 year old and how your completion point with them. And so understanding what and how we look at the metrics of success of a competency-based program in a field that is so nuanced and requires so much individualized responsiveness to children's emotional well-being. And I think that is another challenge that we have, but also the scalability. I mean, there is a tool out there for early education and care called the class that takes an observable qualified observer. Thank you. Yes. that you go in and watch a teacher-child interaction. To do it well, you need 4 cycles of 20 minutes to be able to code. You need a lot of training for your observers, and it becomes a very expensive process to do at scale. And the question is, I think, as we look at that, is that the investment we want to make, or are there ways that you can capture pieces of that and really think about how you look at competency-based approach to this real workforce that needs to be focused on the teacher-child interaction and the family teacher interaction. When you look at those kinds of approaches, how do you measure and then scale a metric to be able to fuel a workforce that can double in size over the next couple years to be able to respond to the needs of children and families? So all of those challenges that we have in talking with Chair Lusso and with our the plan for the board. One of the proposals that we're making, EEC, in the FY20 budget, as FY21 budget, was provided a public-private trust fund that's really designed. At the time it came before any of the federal funding, was designed to help meet the urgent needs of the field. I think we can all agree, and the board has certainly talked about, that one of the most urgent needs of the field right now is building access to workforce that would help sustain and rebuild a very fragile, as Paul pointed out earlier, long-standing issues with our programs of being able to sustain it and define the workforce-based approach that we need. And so as we've looked, of course, there's $500,000 dedicated to that process. And as the CARES Act came with $45 million, and then CURSA and ARPA, we've been focused on trying to get large amounts of money to the field to stabilize them, but recognizing that there was an opportunity for us to think deeply about how we leverage the public-private partnership, the public-private trust fund, to really help accelerate our learning on this critical component of the field and the workforce pipeline. Obviously, with public dollars, we have to do a competitive process. But in order to do that, as we started talking across the EEC team, we felt the need to bring in some additional external expertise, partner with you all, and really think at a more macro level of what we should be achieving in the long term with this short-term type investment. And so in doing so, we would like to propose that we restart the workforce committee with the objective of helping inform an RFP, a competitive process with these dollars that will help us set some benchmarks, some definitions, and help the field who is working through various ways of either reforming preparation programs or starting new preparation programs amidst a new landscape, how we can support with a more global vision and definition from EEC's standpoint that can be used to help measure how this would fit into the overall investment in a system long term. I know that many of you are probably asked about, and I certainly am asked about, individual pilot programs pretty consistently, and having more of a consensus built around what we should be achieving with these would not only serve EEC's conversations, but I think program and the Commonwealth's conversations around this critical workforce as well. And so with that, Chair Lasso, I'll turn it over to you to further the discussion.
Yeah. We really just wanted to put the sketch out there. Obviously, you can imagine there were some best laid plans in December, and then Omicron hit, and we decided we better keep the commissioner entirely focused there. But the idea would be to talk over the next few weeks about who might be interested in plugging in, and also you'll see from that slide even, our thinking is that really, in many ways, to kind of move this innovation idea forward and keep this conversation productive at the level of innovation that sort of intersects between practice and workforce development and has a lens of scale. It strikes me that the committee will need to do a fair amount of listening and curating examples and sort of wrangling a space that is actually very nebulous and diverse in a good way, but also, hasn't really been tackled at the systems level. What do we mean by competency-based in terms of ways to get to not just shared understanding, but like Joni, you and I have talked about this for a long time, but like at some point there's measurement and assessment, and what really does that look like across a mixed delivery system, and from a state perspective, an agency that oversees and supports a field rather than just simply from the ground up in a small example. And I think there's a lot of opportunity there. I was excited about this as a potential concrete next steps to some discussions in August, and then again in November, and now sort of looking ahead to the second half of this fiscal year. Maura.
So just at a meta level, I'm raising my hand to volunteer to be in the group, if that's.
Well, you were already, you know that how everyone's saying like now voluntold.
Oh, I was
So I
voluntold.
think there's a few of you that we may just need to do that too if you don't raise your hand, but that would be great.
So I'm raising my hand, but I also, there's a few things, just this idea, but just to connect to just some of the content, Commissioner, that you just shared, that I just wanted to say for posterity. So first is just, as you went through some of this content, I just want to salute the slide on the EEC professional pathways update, for the content being what's working well and what is challenges. I just find as a board member, it's much easier to know how to be of value when you have that laid out thoughtfully. So just cheers on that. The second is you mentioned like success metrics, but then you also said something about how it's hard to know what's successful. And I find sometimes our metrics are like reporting on the numbers of what's happening in a project, but I can tend to lose sight of what is the goal of this project, even if we're not close to hitting it. If the goal is a numerical goal, great. Like EEC professional pathways, we want to hit ultimately our hope is X number of people use this. And if it's not a number goal and it's a learning goal, we want to learn X learning outcome. So just again, like just as the making sure we can be of the most support. And then the third thought, sorry, it's all sporadic, but it was just so much content, is so the class tool as an example. I think I love the idea of doing this working group on competency training. But if we don't have a framework for success, when we don't have a planned investment on what outcomes are, and like it just, I worry about sort of we're doing inputs and with an absence of a solution on the frame for like to what end. So I guess you mentioned it's expensive, but I do feel like it is expensive if you define it. And I'm not advocating for the class as a product, but like the idea of having a frame for cycles of improvement and data-driven improvement that is not just to buy the tool and the cost of buying the tool, but because it's the thing that drives the mindset and the definition of outcomes. So maybe that's going to sit in the process, the RFP process. I'm not clear about that, but I just worry if we're not feeling like we can invest in that this might be short-sighted.
Yeah, I think that's really important that this is actually situated in a massive amounts of investment that is going into next year around a complete overhaul of our quality rating system that we've been talking about, around the credentialing system, and those investments are being made. But one of the big components that we hear all the time is that's great. You can set all these lofty ambitions for quality. You can send all these lofty ambitions for what our workforce does. But the fact is that we're basically pulling people out of Amazon and begging them to come in our program. And you see this in the data we saw from programs. And we aren't matching that up with the types of external resources that can help build competency. We have higher ed that helps build knowledge a lot, but even then we hear gaps between the knowledge that's being built and the competency that's needed to go and perform on the ground in a stressful classroom. And so I think that it is important. I think part of the process will have to be more as us talking a little bit more in depth about where some planning are on these investments. But I think the challenge is that to Paul's earlier point, that so much of the system was so bifurcated before that we're sort of building pieces simultaneously. And this is a critical link that has to be situated in the rest of those, right? We need to reward programs for monitoring the quality of those interactions and integrating that into their improvement cycle through a continuous quality improvement structure. We need to make sure that there is a clear articulation of what a ladder looks like for staff for educators to go from entering the field to proficient and leading in the field. And we don't really have that credential built out. But as we get closer and closer to those components, we're still in this question of, but what kinds of trainings, not even what is the perfect training, but what kind of preparation programs would help us better integrate into these emerging structures that I think we have to look at to cohesively. So I think good point that we have to bring those other updates on those other pieces more actively into the conversation for sure, and hope that those two can be fueled by a conversation on what could we be measuring our preparation programs by that would help us integrate in and help us bolster these other two systems that will sort of stand alone if we don't have that part. Does that help?
It does. And I think, I mean, I want to keep celebrating when you share, here are the challenges and here are things we're working on. Like, I love, that's great, and keep doing that. And so I think I didn't realize it's challenges and we have a plan, and we actually have something we're working on. I think I missed there's a mitigation to these challenges in the work. So yeah, keep coming, help, at least I know me, keep coming back to how all these pieces, you have a grand vision of how they're all going to unite.
Yeah. I mean, I think the challenge, we hope that, but I think that the challenge is that, I will say, going back to the strategic planning, so many of you may have heard me say this a bunch of times, but I think one of the challenges we have nationally with quality rating systems for childcare, which is a requirement for us to have a quality rating system of some kind, is that the research on the efficacy of those quality ratings is that they've been moment in time kind of captures of what is, did someone fill out the application? Did they meet the criteria in time? When we know that quality in early education and care is about that human interaction, and the human interaction between the leader and their children and their staff, the staff and their children, their ability to be able to set up a classroom so that children can engage with each other. And that's a much messier thing to try to measure than going in and observing our, either our licensing regulations, which are baseline health and safety, or a quality rating that can be a capture of one point in time. You see different approaches, and we can go over this as we kind of delve deeper into this, but you see different approaches and different components of the early childhood system. Head Start has incorporated class, but after about 5 or 6 years, maybe a little bit longer of putting that in, actually had to pull it out as a metric because we couldn't figure out how to quite integrate it in a way that didn't become high stakes compliance and really did justice to the real nuances of emotional responsiveness to both adult learners and child learners. And so I think that that's some of the ways we have a lot of lessons learned of where measures of program quality have led to more of a compliance mindset than a continuous quality improvement mindset, and not a ton of examples of success. But I do believe in Massachusetts, we have the opportunity to try to forge through to try to demonstrate success in really different ways, given the robust system we have in place.
And of course, not specific necessarily to early ed and care, right? To try to drive meaningful, sort of meaningful, tractable change at the level of the individual practitioner, healthcare, K-12, it's a challenge. So, but I do think this is a moment for sure to keep pushing this notion and see what nut, if we can crack the nut a tiny bit more. But I also want to say, just since we're meeting as a board, I think also want to be sure that we have some board priority work that can expand some of the agency's bandwidth while also, completely acknowledging and supporting the fact that the agency is totally deployed in terms of resources and bandwidth. So I did want to push us to say, how can we catalyze a little bit more as a board and roll our sleeves up a little bit more at a moment that would be helpful in our partnership role to the agency. So we'll approach it with that spirit in mind. And I do think we could make some progress over the winter and spring.
And I will say, Charlotte, so to that point is that you have, you've been hearing from senior leaders who are quickly catching up in their role and trying to take on a lot of transformation. And we get very mired in the day-to-day, how does this metric going to work, and can we get the registry out, and how do we think about things like that? And I think the opportunity for us to participate in the conversation, but also fuel a broader perspective that you all bring to the table will be, I think, invaluable to help integrate a more cohesive, comprehensive look at what is available out there and how we can apply it to this field. I think there's also a default to go a lot towards, okay, are we building the K-12 system? Are we replicating that approach? And I think for those of you who have been involved in K-12 systems, either here or nationally, a lot to learn from that approach too, that we can apply differently in a field that that needs not only different structures, but also can really try to take lessons learned actively as we build this.
Joni.
So thank you. I think this is certainly an exciting conversation to have, and provides the board, the field, the department with an opportunity to really look back at what has happened over, but in my professional career, the past 3 decades in Massachusetts, 3 or 4 decades in Massachusetts, regarding professional development, development of a continuum in the field, and the work that OCCS, Department of Labor, the Department of Ed, DPH has been involved with in leading up to the work that EEC did, and the councils and advisory councils that are in existence in EEC right now. I think this is a moment in time when we can take stock of what we know, what we've done, and where we need to go.
Yeah,
So
and
I
let's
welcome this opportunity.
Yeah, and let's push on not just what we've done, but what was the impact, right? And go
Absolutely,
after
the lessons
yeah.
learned.
Yeah, and maybe the results, right? Yeah, no question. No, for sure. Yeah. Great. Any other thoughts, comments? Again, sort of early stage, just a sketch, kind of taking temperature, gauging interest, but it seems like we may be at the right moment to do a little bit of subcommittee work between meetings. Good.
Excellent. So for next steps for us, just so all of you know, and to let everyone publicly know that the board will be organizing ourselves to make sure that we can get time in the calendar, as Chair Lasso referenced. We have someone who's recently come on staff who can help staff and do the work of supporting the committee's thinking, and we'll look to make these meetings publicly available on Zoom, and opportunities for people to weigh in afterwards, so there's continued dialogue around this as well, as the committee delves into what kinds of topics and approach we want to take to the conversation specifically.
Yeah, and I think just logistically, I'll connect with folks, but I think we'll just create a standing meeting and structure and go from there. So we'll keep in touch on all of that. Right, next steps.
Excellent. And we'll put that for anyone who's listening to us, and we'll make sure that that goes out on the board website as well, so people can keep up to date, as well as out, of course.
And we'll look forward to lots of examples from the field. To Joni's point, there are lots of examples out there, and there are many lessons learned and along the way, and how that drives into the next chapter will be really interesting and important. Great.
So that is the extent of what we wanted to discuss in today's meeting, to be able to talk through where we knew that we had a gap and go a little bit deeper on our workforce initiatives, specifically in this area. I did mention in my opening comments, but we'll just reiterate in the appendix of the materials that there are our general caseload numbers, as well as an update on the parent fee implementation. We still are on track to be able to have programs start assessing fees the beginning of February as federally required. We will, a reminder to programs and to families in this moment that we do have to start assessing fees, but we should be flexible with parents who may need time to start the collection of fees. We are encouraging all of our programs through this transition to make sure that they are as friendly with families as they possibly can be while sustaining their own operations. And so continue to reiterate that, and feel free to reach out to subsidy administrators or our subsidy and for the board to make sure that if you do hear of any concerns, feel free to send them to us, because we are supporting programs as actively as possible, as we know this is a really big transition after 2 years of paying parent fees as well, and much turnover in the field. So this may be new for some people out there too. So aside from that, one note on the caseloads as we move forward is that some of our recognizing that some deeper conversations with our child care resource and referral agencies that we've been having to help understand how we can support families both in getting into childcare, seeing the fluctuations of enrollment, but also our families who have been on job search eligibility for a significant amount of time, as we look at supporting them to get back to work, of ways that we can use increased investment with our childcare resource and referral agencies to build the connection between our childcare, our subsidized childcare parents and the workforce boards and the workforce efforts that we have going on throughout the Commonwealth. So more details on that will be in February specifically, but just want to highlight as you look at these numbers that we are actively trying to strategize with those partners who are engaging with our families on a daily basis, regular basis, to be able to support that real integration with the additional workforce supports that parents are needing as well. And looking forward to discussing all that with you in February. And I believe that that concludes what we had planned for the agenda.
Great. And you'll have just heard that it's kind of rolling. So we've already got placeholders for February. These are short months and there's a lot happening. So Joni, were you about to jump in? Are you good? Okay. All right. Well, with that, I want to thank the commissioner, the deputy commissioners, Jocelyn and Caitlin, for their presentations, and to all folks who are involved in the work behind the scenes, but most importantly, want to send a message to all early education and care educators, providers, practitioners. Thank you all for your tremendous work day to day, and we wish you health and wellness, and to please stay in touch as we can help. So, and thanks to all of you for today's meeting, and we will be in touch on the subcommittee. Meeting adjourned. Take care.
Take care, everyone.
Bye.